Hi, I'm Daisy.
And Tyler.
Our case today is a 27-year-old man with a nail in his eye. So the guy got a nail in his eye from cutting weed at about 1:50 p.m. and he was brought to Mass General at about 2:15. And he reported severe pain in his right eye, about 6 out of 10, and swelling and loss of vision in his right eye. He has no loss of conscious, and his left eye is totally reactive. There's a brief episode of self-resolving epididymitis, which is nose bleeding, and there is no other neurological symptoms. He has a medical history of bipolar disorder, and he's on lithium right now. All the physical examination and lab tests were normal, except the nail penetrating the eye posteriorly and medially. So to determine how deep the nail was in the eye and through the skull, they ordered radiology. And here's the picture of the guy. And the clinical diagnosis is penetrating orbital trauma.
So the image was ordered because the nail is a metal foreign body, so the proved it to be a challenge for the CT image. First, this is a traditional single energy image. You can see this is a nasal cavity, and this is a maxillary sinus, and it will be its right orbit, so the nail will travel medially and posteriorly like this.
Wait, sorry, the video is not working. There we go.
So you can see the nail enters from the right orbit and penetrates the ethmoid air cell and the sphenoid sinus and terminates near the optic nerve and carotid sinus. Because the nail is metal, so it appears with the bright flare and has a very large streak artifact that makes it very hard to decide its exact position to the optic nerve and artery. So the question here is that if the nail has damaged the optic nerve or the cavernous carotid sinus, this will be very important. Or if the nail has damaged the artery, there will be severe intracranial bleeding and will be deadly for the patient. So they choose to use the dual energy CT image. This would effectively reduce the streak artifact and make the nail appear to be more precise. This is an oblique image, so we could see the precise road of the nail enters. So this solid arrow here will be the optic nerve, and this dashed arrow will be the internal carotid artery. So the precise image demonstrates that the nail is very close to these structures, but it did not touch them. What about like 1 millimeter away from them? So the diagnosis from the CT is that the nail enters between the right orbital rim and transfers the right ethmoid air cell and the sphenoid sinus and terminated at the optic roof near the internal carotid artery. This is a model of sphenoid bone, so the nail would enter from here and travels through the optic sphenoid sinus and terminates around here. This is a 3D model that demonstrates the nail. So the CT image shows that this man has his right lobe intact, but it retains the spherical shape, and there was no injury to the left optic nerve or the artery. So surgery was able to successfully operate it.
So to prepare for the surgery, they have to have this general concern related to penetrating cranial trauma, including two factors, that's the missile properties and trajectory. And in our case, very fortunately, because of the velocity of the nail is not too fast, and the concussive wave did not influence the carotid sinus, and so from all these concerns, the doctors were able to determine the extent of the injury and whether there will be infection and how they're going to extract the nail, and whether there will be an immediate vascular injury or delayed vascular injury, including cerebral spinal fluid leak, which is a major risk for infection and also seizures. So the neurosurgical goals are to remove the projectile without additional injury and be prepared to control potential bleeding. So they don't want to do a craniotomy unless they really have to. So they try to obtain proximal and distal control to trap the potentially injured segments and minimize possible hemorrhage. And these are all the treatment options, and they chose the second one. They prepped for craniotomy, but they did not perform it because they did not injure the carotid sinus, and there's no internal bleeding when they did the surgery. And here's a picture when they did the surgery. And we can see the nail, the doctor holding the nail that's been extracted. And they also did a CT angiogram after the surgery to make sure that there was no bleeding.
So the post-surgery CT confirms that the nail is very close to the internal carotid artery and the optic nerve, but did not damage them.
And because the nail went through in his right eye, there is scattered retinal bleeding, which is showed in the image by the red dots. And there's also extensive nasal retinal whitening, that's the yellow part in his right eye. And the image in panel B is his left eye, that's totally intact. So our patient, after the nail was removed and his globe was intact, he was able to recover his visual, and he can see 20 out of 20 visual bilaterally. So he was very fortunate, and that's about it.
Thank you.
Can you explain why they give a tetanus booster?
Because there would be rust on the nail, that would be a major cause of tetanus.
I'm sorry.
The rust on the nail would be like infection, would be cause of tetanus. So a tetanus boost is needed.
Do you know how the nail got in his eye?
He was cutting weed and it was like thrown into his eye, and that was like all they said in the report. So I imagine it was like from the grass or like from the machine or something. I don't know.
Wear your goggles.